I'm in a constant state of fear.
The U.S. healthcare system faces a crucial dilemma. How do we keep healthcare workers and their families safe during COVID so they can take care of the sick? For answers and insight, watch Outlook Montgomery.
I want to say I do feel safe because I want to look at the positives, but I can't be ignorant to all of the facts.
America is facing a healthcare workforce crisis. Many factors contribute to the healthcare worker shortage, the most recent being the COVID-19 pandemic.
I think it's very difficult for a nurse or a healthcare worker to be, worried about their own health and safety, but also worried that they might take this home to their family. So there's a lot of emotional baggage, I think, that's going on right now.
I have a constant state of feeling unsafe. As a healthcare worker, it's really hard to come to grips with that because we can't quarantine ourselves. We have to put ourselves out there to do our job, but to make a difference in what we can make a difference in.
The Centers for Disease Control reported that through the end of August, more than 150,000 doctors, nurses, and other healthcare personnel in the U.S. have contracted COVID-19. So how can healthcare professionals stay safe at work?
In order to stay safe, we're implementing a lot of policies on protective gear. So that means wearing masks all the time in the hospital, no matter what. And then when it comes to patient care directly, before we go into the patient's room, we put on a gown, and it's a single-use gown. Although we've started to transition to reusable gowns, which is really good in terms of PPE shortage. For more infectious patients, we either are supplied with N95 masks, or an alternative is the PAPR helmet or the PAPR hood. To keep healthcare providers safe, we ask that whenever we go into the room, any patient who's old enough to wear a mask, put on a mask when healthcare providers come in. We've done a good job of implementing those and communicating that to patients and families to ensure that the healthcare provider safety is solidified.
In Montgomery College's Health Sciences program, there's a strong emphasis on proper clinical procedure for the health and safety of the soon-to-be healthcare workers and their patients.
Safety is our number one priority. Safety is the first skill that you learn in an on-campus lab. We teach safe handling of the patient, of the equipment, of medications, proper hand hygiene, proper technique to put on and take off your personal protective equipment.
Very early on in the course, they did a hand washing exercise where they put this UV reactive lotion on our hands, and they told us to go wash our hands, and then they shined the UV light on our hands to show us where people commonly miss. So from that moment, I realized how important cleanliness and safety was in the medical field. They really, really emphasized that point.
Foam in, foam out is like the biggest thing that they always talk about, meaning as soon as you go into a patient's room, you're going to put that hand sanitizer on the wall in, and as soon as you leave, you're going to put hand sanitizer on. Always wear gloves. And they talk about reading the paperwork from the patient and how important it is. Reading those notes that people leave can give big hints to how to prepare yourself when going into that room and how to keep yourself safe, how to keep the patient safe, and then everybody else you're going to be interacting with.
Safety is an outcome that is actually threaded throughout every curriculum, every program, and it's threaded throughout every course.
Even with the potential dangers, Montgomery College's health sciences students and alumni are absolutely dedicated to being on the front lines to help heal their community.
My time at MC has really taught me the true sense of community. Like, this is my home, we're going to take care of it, and to give back whenever we can. We should constantly be uplifting each other and making sure that our community is taken care of. And so that's what MC has really taught me.
We're going to be medical professionals. I would really rather be out there applying what I've been learning. But, as much as I would like to be out there being helpful, I understand that there are certain steps that have to be taken to maintain safety and integrity. I am not a qualified rad tech just yet, but as soon as that day comes, I will be out there applying everything that I've learned in this course so far.
I just want to graduate as soon as I can so that I can get out there more. So the pandemic hasn't scared me into not wanting to do it anymore. It's made me more motivated to like feel like I'm doing something. I want to be on those front lines and I want to get out there and help.
Become a healthcare hero. Visit montgomerycollege.edu/health sciences. Big issues, local impact. Outlook Montgomery.